Let me walk you through the complete course of gynecomastia treatment. Hello, I'm Dr. Sheetal Londhe, board certified plastic surgeon, practicing at ZeroSize, Vimannagar, Pune. So, when a patient has doubts that he has gynecomastia, yes or no, or he is known that he has gynecomastia, we book a consultation for him. During the consultation, we will do a thorough examination of the gland and the fat tissue to rule out that yes, whether it is real gynecomastia or pseudo gynecomastia. If it's real gynecomastia, we categorize it into the category 1, 2, 3 and 4. And depending on that, the treatment options have been decided for the same patient. So if it is just grade 1 and 2, yes, we will plan for the surgery and the date will be given to the patient. But if it's 3 and 4, we first do a counseling whether the patient is okay with having a scar for removing the gland along with the fat and the breast tissue content. So depending on that, when the thorough consultation is happening, patient gets enough time to decide that what and when he has to undergo the procedure. Before that, we run a couple of tests which gives us peaceful that the patient's hemoglobin is good for the procedure. Something called as the PT-INR, that is the blood clotting and bleeding time, is normal because when we do liposuction, we want the bleeding to be in the normal range. Also, in grade 3, 4, we do ultrasonography, that's of the breast tissue and the chest area, just to rule out, yes, the fat content is how much and the breast tissue content is how much. This helps us during the procedure because we know how much fat we are going to remove and for the gland, what type of incision we need to take. So, this is just your decision at home. You coming to my consulting room and we planning for your surgery. There are many things that happen between this. You go to the labs, you go to the sonologist and you decide on the date of the surgery. Prior to the day of surgery, you again come for consultation. We do a thorough measurement and marking of the area that has to be worked on. So the gynecomastia from where the fat has to be removed, maybe from the clavicle down, then the axillary fat is there. There is lots of deposition around the gland tissue. Yes, is there going to be a skin reduction? Do we need a skin to be removed? And all those things have been calculated and the fat areas where liposuction is to be done is marked. We also have to take care that there's not a shouldering effect, that the chest is made flat completely and the abdomen bulges out. And then you have a shouldering effect. Decision for undergoing a gynecomastia was not correct. Like a shoulder coming out from the chest wall. So that smoothness and all has been marked where we are going to work the next day morning. Pre-operatively, my team gives good instructions and pre-operative workout and all for them. That includes when you are supposed to eat, what is the last meal time that you should have, when the water should be stopped, bathing, shaving of the hair around the chest and the axilla. All this thing has been counseled to the patient and the relative. Most important, the patient should be cool and calm. So he has to feel that yes, he's ready mentally and physically for the procedure. Patient comes for us to the admission the next day morning. Usually we admit around 7 a.m. After coming, the patient gets an intracath. That is from where we are going to start the IV line for giving antibiotics, normal saline RL, the IV fluids that is, and painkillers after the procedure. We also give some injections which are going to reduce the bleeding intraoperatively. This procedure is done under general anesthesia. So the anesthetist, now the patient from the room is now going to the OT, that is the operation theatre. Anesthetist gives general anesthesia over there. All the vitals are monitored on monitor. And we start with the procedure. A thorough painting and draping has been done and we start. So first we always do liposuction. I use the VASER liposuction because it also takes care by melting the gland, not only the fat, and also shrinking of the skin, which is more redundant on the part in the sides of the chest. Once the liposuction is done, it is done through a small hole through the area of the nipple and areola only, so that there's no scar being seen later on. After the area is completely flattened, not only the chest but also the side walls, we take a decision that we have decided prior during the consultation, whether it was grade 1, 2, 3 or 4, whether the gland has to be excised. If the gland requires to be excised, yes, incisions are taken in such a way that they will not be seen later on and the gland is completely excised. A good hemostasis is done and we stitch it back. After that, patient has been put on pressure dressings. There's a good healing over there and patient has minimum pain. Painkillers are given through that IV line. We also put a pain patch so that for the next 24 hours, this pain patch will give the drug very, very slowly and patient will be pain-free throughout. 6 hours after the surgery, patient is allowed to give sips of water. If it tolerates it well, we give them some liquids, some juices, something. And if it tolerates well, then yes, soft diet is there for dinner. Next day morning, patient gets up, walks, does everything, do his all routine daily activities. We remove the dressing, do a thorough cleanup and give a small dressing and put a pressure garment to the patient. Pressure garment is a very tight waist that the patient is wearing. So it takes care of the good healing. There is no formation of any collection over there, which is called the seroma. No hematoma is formed. And also the skin, which has been liposuction, will be shrunk over a period of few days. So this compression garment that we make the patient to wear, patient has to wear it 24/7 for the first 3 days. Usually, we tell them only for bathing you can remove it and then again wear it. After 3 days when they come to us for a follow-up, we remove the dressing and send the patient home that they can use the pressure garment for at least 22 hours per day and remove it for their daily activities of bathing. So during hygiene hours, they can remove that. So this is the complete course. First follow-up is on day 3, then your follow-up is on day 7, and then on day 15. And that's it. And then you can enjoy your beach body. This is how I have now taken you through the journey of a gynecomastia. If you have any more doubts regarding the same, please visit us at ZeroSize, Viman Nagar, Pune.